The news day continues here on One News Now. I'm Sean Yao. The health department is now studying the possibility of a shorter quarantine period for vaccinated individuals. To tell us more, we have JC Cosico joining us live from Mandaluyong. JC, hi. What prompted the DOH to consider the shorter quarantine period for vaccinated individuals, and how short exactly are they planning to cut quarantine to?
Sean, according to the health department, the shortened quarantine period for the general population will also be the same of that of health workers. So that means 5 days for the positive, mild, and asymptomatic COVID-19 positive patients. Now, that's if they are fully vaccinated and no quarantine or isolation for those close contacts. So that's amid rising COVID-19 cases. Sean.
That's right. Amid this same rise in COVID-19 cases, very steep rise that we've seen in the past 2 weeks, some are saying, JC, that the shorter quarantine policy is actually illogical. What did the DOH have to say counter to that?
Sean, according to the health department, they won't put the public, the patients, and the health workers at risk, saying that their decisions are based on science and on existing evidence. Now, according to Health Undersecretary Maria Rosario Vergere, there are also countries doing the same. And apart from that, they are also planning, again, to include the general population on this. Sean.
Right. And JC, I'm going to have to ask you the DOH's outlook on the number of cases. What should we expect in the coming days? We know today came in a little low, but it's also Tuesday. Historically, we get lower number of cases on Tuesdays. So what are the latest projections? And can we really expect it to peak at 40,000 cases per day?
Sean, there was no mention on this during this afternoon's press briefing, but according to the DOH, they are expecting COVID-19 infections continue to increase in the coming days because of the high transmissibility of the OMICRON variant. Sean.
Right. And of course, all the NCR mayors are saying it's not yet time to go on level or COVID alert level 4 because our hospital occupancy rates are not there yet. What is the latest numbers on our hospital utilization rate?
Sean, according to USEC Vergere, the country's national healthcare utilization rate remains to be at low risk, 40% for ward beds, while 38% for ICU beds. But there are some regions like here in NCR nearing the moderate threshold when it comes to COVID-19 beds. But this is not much of a concern yet, according to the health department, if we are going to compare this during the surge of the Delta variant. Sean.
All right, and speaking of variants, JC, Omicron is now considered dominant here in the Philippines, but can the DOH actually categorically say that there is already widespread local transmission, or have they actually come out and said it?
Sean, the DOH said that there is no establishment yet of the local transmission of the Omicron variant in the country, but there is high likelihood that the variant is now in the communities, according to Undersecretary Vergere. Now, she also clarified Health Chief Duque's earlier statement that Omicron is now the country's dominant variant, saying that the health chief was just referring on the latest samples sequenced. That's according to USEC Vergere. Still, the dominant variant in the country, according to the DOH, remains to be the Delta, followed by the Alpha variant and the Beta variant. Sean.
All right, we'll leave that there for now. Now, regarding COVID-19 test kits, which are selling out everywhere in the gray market, JC, The FDA, of course, recently opened applications for self-administered COVID-19 at-home test kits. Are there any applications already up for review for now?
Sean, the DOH confirmed that there are two manufacturers or suppliers of self-administered test kits which applied for a product registration with the country's Food and Drug Administration. Now, they are now expediting this so that the public can administer COVID antigen tests at home. But once these are out in the market, the DOH said that the public must be careful on using this to avoid misuse or miscalculation. Or misinterpretation, rather, Sean.
All right, JC, thank you so much for giving us all those updates and numbers. That was JC Kosikov, News 5, reporting to us live from Mandaluyong City. Stay safe, JC. And the health department reported 28,000 new COVID-19 cases on Tuesday, a bit lower than yesterday's all-time high of 33,100. Active cases have gone up to 181,000, while the total caseload still stands at around 3 million. The DOH said 97% of the cases are mild and asymptomatic. More than 200 people died of the virus overnight, bringing the death toll to 52,500. Out of these newly reported deaths, only 17 occurred this month, while the rest are backlogs. Total recoveries, meanwhile, are at 2.79 million, after 4,400 new survivors in the past 24 hours. 44.5% of the 58,000 tests included in today's bulletin yielded positive results. The DOH said 12 labs failed to submit data. And PhilHealth will be offering home isolation packages for asymptomatic and mild COVID-19 cases. Deputy spokesperson Ray Balena confirmed this to One News's agenda. The package includes virtual consultations, clinical care, and treatment kits. Balena said the package aims to help decongest hospitals amid the surge in COVID-19 cases. He adds that a testing subsidy is also being offered to priority groups.
So para makatulong tayo na kumbaga madeklag yung mga hospitals of non-critical cases, sorry. So kaya meron tayong ganitong alternative. So tama po yung inyong nabasa sa Facebook. Meron talaga tayong home isolation package, no, para sa mga patients na mild at asymptomatic.
And the Foreign Affairs Department's passport services have been temporarily suspended after more personnel tested positive for COVID-19. Camille Samonte with that story.
President Duterte says government offices should remain fully operational to ensure the effective delivery of public services. Duterte made this remark amid an uptick in COVID-19 cases among government personnel, including healthcare workers in public hospitals.
Alam mo kung bawalan tayo, tapos lahat sa gobyerno kasi opisina yan. Opisina por opisina por opisina. Ngayon, if bawalan mo lahat magtrabaho, then the machinery of government will stop to grind. Then sino ngayon ang what is the face of government at this time? Tayo sa public, we do not want to, hindi naman violate, we do not want to do it.
Duterte noted that some agencies are doing its effort to mitigate the short staffing.
Now, mag-compromise tayo. That's part of the game. Yan ang trabaho namin. Ngayon, kung mag-COVID kami, then so be it. Kasali sa trabaho yan eh. Now, kung mamatay ako, then so be it.
Under Alert Level 4, government agencies will remain fully operational with at least 20% on-site capacity for workers. The Department of Foreign Affairs, however, announced that operations of its consular services and off-site passport services will be temporarily suspended due to the rise of COVID-19 cases among personnel. The temporary suspension of operations will be from January 12 to 20. During the said period, no passport or apostille applications will be processed or released. DFA Undersecretary Dodo Dulay said more than 50 personnel tested positive for COVID-19. Most of their staff are also identified as close contact and need to undergo quarantine. The agency will be implementing a skeleton workforce during the temporary closure.
Nagkaubusan ng mga tao at ang nangyayari pag hindi namin ginawa ito, Camille, baka mas lumala, lalo kami hindi makapag-operate for a longer time. So we just need to do this now while people are still not that widespread pa yung infection and yung iba namin ina-assume namin na positive, symptomatic. So we hope that with this short time out, it's really just a period of 7 working days.
Passport and apostille applicants who are affected by the temporary closure will be given a new schedule to be posted at DFA's website. The Land Transportation Office also suspended its operation beginning January 10. In a statement, the LTO said the main office will be closed for disinfection after majority of employees who interact with clients have either tested positive for COVID-19 or have been tagged as close contacts. The LTO also reiterated that it will extend the validity of driver's licenses expiring in January to March for another 2 months. The PNP meanwhile continues to see a spike in COVID-19 infections among its ranks. Data from the PNP Health Services showed that 436 new COVID cases were reported on Monday, bringing the total active cases to nearly 1,884. PNP Chief General Bernardo Carlos tested positive and is still in isolation. The PNP Health Services said the quarantine facility in Camp Crame is already full. Out of the 380 beds, only 16 beds remain vacant.
Ginagawa namin ngayon siya ng paraan. Ngayon nakahanap kami ngayon nandito ng isang area of venue for the additional quarantine facilities. Inatis namin yung concerns namin dito. Once na magkaroon pa dito ng upsurge, tumaas pa, we are ready for the increase of COVID patient among the PNP personnel.
But the PNP assured that their services will not be hampered despite the increasing number of COVID-19 infections in the force. For News 5, Camille Samonte, we are One News.
For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Masks on, wash hands, and stay safe, Philippines. I am Sean Yao. We are One News.